and welcome once again to Functional Medicine with me, Dr. Howard Robbins. This is a very important show today, kind of serious show. I'm going to be talking about the importance of probiotics, microbiome in pregnancy and for newborn babies and for children. Literally, hundreds of studies have been done with predominantly good but mixed reviews and feelings about the benefits um, of them. And we're going to start right off the bat. But first, I want to thank my sponsors. Um, One of my sponsors is uh, Promolife. Promolife makes or ozonated oils, ozonated suppositories, ozonated glycerin, all sorts of ozonated products that you could use in many different ways. If you listen to my show on ozone home care, you'll get an idea of the breadth and scope of all the benefits of these various ozonated products. And all their products are organic. And I think that's very important. A lot of companies, and there's an awful lot of them, make these products. They sell them often at very high prices. Promolife sells only organic, pure, ultra pure products at very fair and reasonable prices, in my opinion. So you go to promolife.com, you can look up all their different products. In addition, what you should do is call them at 888 742-3404. I believe that's their number. 888-742-3404. I'm going to double check on that for you as I'm speaking. And tell them I sent you, and you heard about it here on our show. And they usually do something special for you. They give you a discount or something like that. And I got you the right number, 888-742-3404. I should know it by heart by now, but I get a little nervous, I guess, and not certain. So make sure you call them, whoever you get. They're wonderful people. They're very supportive. Tell them what you want to use it for, and they can make suggestions as to what might be most beneficial, or contact me. Email me at ozonedoctor@yahoo.com. OZONEDOCTOR@yahoo.com, or call my office in Manhattan at 212-581-0101, and they'll put you through to me or give you my number to call me personally, and I'll be happy to help you out that way. Since my other sponsor, Doctor's Biome, is going to be very important to you, make sure you get a pen and paper, because you're going to want to be writing this stuff down. This show is for pregnant women, families that have pregnant women in them. If you have a baby or a child in your family, or you know someone in one of your loved ones or friends has a baby or child, this show is essential and just extremely important for you to listen to. So let's get right to it. When babies are born, they don't have a sterile gut, but they basically are born with probiotics, bacteria, if they exit the birth canal naturally. Now, what if they don't? What if you have a C-section? In the USA, even as of just a year or so, best statistics I could get, C-sections are already up at about 33%. I don't quite buy it. I'm hearing it's even higher. But that means 1 out of every 3 babies that are born, if we keep it to that, do not have any healthy biome in them because they didn't exit the birth canal. And as they exit the birth canal, as they exit the mom's body, they pick up some. The rest of them are going to be given healthy biome by drinking mother's milk, or if the mother doesn't breastfeed, they can get them if they drink, cow's milk, or which is the most common, or let's see, or even infant formulas that may use different things. However, what if you're lactose intolerant? And it's estimated that 3% of the babies born are lactose intolerant. That's not so bad. But there's also an intolerance that people don't understand from cow's milk. There's a protein in cow's milk that you can be allergic to, and that has up to a 6% occurrence in newborn babies. So you're looking at almost 9%, up to 9%, roughly 1 out of every 10 babies could have a problem either with breast milk or with cow's milk. Now, cow's milk doesn't contain probiotics that matter to babies for the most part. It may have some from the cow. Mother's milk, however, does contain probiotics. Believe it or not, probiotics from your gut can reach the breast and the mother can transmit it, provided the mother has a healthy gut to begin with. When exiting the birth canal, you'll give the baby some probiotics, provided the mother has a healthy gut to begin with. The problem is most people don't. Most men and women, and we're dealing with women here, have had antibiotics, even once in their lifetime, or they eat red meat or chicken that isn't organic or farm-raised fish. And I don't care if you burn the meat, you're going to get uncooked out doses of antibiotics in them all the time. Safety would be, hopefully, if you're eating organic meat and chicken and fish that isn't farm-raised, and or kosher and halal, because if it's truly been certified kosher and halal, they're not allowed to give antibiotics to the animals, and thus you can do it. I haven't eaten meat or chicken in 45 years. I'm doing pretty well, but most people have, and thus the mother doesn't have a healthy gut, though you may think you do. Now, many studies have been done, and we've done shows on this, so I'm not going to waste our time explaining to you that capsule, powder, and tablet probiotics are virtually worthless, near worthless. Why? Well, if you go to the 60-minute show that was done in June of 2020, and you can get that on YouTube, and you can get it in other places as well. That show got Dr. Eliav Segal, who did a wonderful experiment showing how capsules and tablets, capsules in particular, may not even open up in your stomach, and thus they found in the feces in their study, you listen to that show, it's an amazing show, tearing probiotics apart, making them virtually worthless. Basically saying that they may open or they may not open, but what they found in the gut was everything that went in the mouth came out the other end. They found nothing but dead bacteria in the amounts that they put in. Well, and then another Dr. Hibbard from University of North Carolina Medical School claimed, if you feel some benefits, it's because you expect to. Basically, a placebo. Now, why? Well, the freeze-drying process destroys these very delicate probiotics to a great degree. Then you're hoping they're going to come out of suspended animation in the freeze-dried state and have enough time to grow into healthy adults. They don't. Or they're destroyed by the stomach acids, because you have to have next-generation bacterias, next-generation probiotics to survive the stomach. And you need to have them, what they call smart probiotics. You can't make this up. They didn't go to Harvard or Yale, but you have to have smart probiotics that can actually stick to the wall of your gut, technically, in a sense, then become part of you. That's That's the problem. They don't. Now studies are coming out one after another, and papers are being published showing that certain bacterias can be beneficial. And the bacterias that they're looking for are Bifidobacterium infantis, which is one of them, one of the big ones that have been studied. And not just any version of it, but these patented strains. Now, what does that mean? They've made strains that of this particular bacteria, and they're obviously way more costly. That drives the price up of the product. So cheap is cheap. Nothing good is cheap and nothing cheap is good is an old expression. And cheap can be expensive because it just doesn't always work well, and you need a lot more of it. But the bifidobacteria have been very studied, and they found that babies do very need the Bifidobacterium infantis to be able to digest food better and absorb the nutrients better. And study after study is coming out, and I'm going to go over some of them with you, showing why that bacteria and others are important. And guess what? These are the bacteria that are found in Doctor's Biome. So when you go to doctorsbiome.com and you go to buy it, know that it's there. But I'm going to go into what I believe to be very important dosages to give. So right after birth, the baby's gut undergoes a very complex process and an assembly beginning of these new microbes from the mom to hopefully aid in digestion. Risk is a very important issue that has been studied by all the major gastrointestinal groups, both here in Canada and in Europe. And particularly on babies that were premature, for example, which is another issue that you may be faced with in your family or with your friends. And they found that probiotics can be very beneficial, and very rare is there what they call sepsis, some kind of abnormal infection caused by taking these bacteria. Well, you want to have bacteria that have been tested for safety. And that's one of the benefits of Doctor's Biome, is that every small batch that's made is tested for safety before it's released by the first from the laboratory, an independent lab, and then by their food scientist, Dr. Kamari. He has to look over the results, and when he gives the approval, they release it. So there's many recent studies, and you can go on to pubmed.gov, our National Library of Medicine, and find a lot of these. I'm giving you the benefits of understanding them. So one study, Dr. Acker, published in the Pediatric Gastroenterology Journal just a few years ago, talking about preterm infants, said quality reassurance of the probiotic product is essential. Probiotic strains should be devoid of transferable antibiotic-resistant genes, and local microbiologists should be able to routinely detect probiotic sepsis. And that's why testing a product for safety each and every time it's made is essential. And small batches. Now, the difference is Doctor's Biome is a living probiotic beverage. All the 15 patented strains of next generation smart probiotics, so capable of surviving the stomach over 90%, not being almost completely destroyed in the stomach. They're all living to begin with, so they don't have to come back to life. They're growing in number every day. How are they doing this? They're being fed what's called prebiotics. Prebiotics are the food that probiotics eat. Okay, they're living organisms. They want to eat something just like you and I do. So the prebiotics that are in there are made up of the vegetable, well, they're living in what? A 100% with Europe, with German certification, not just US certification, but German certification, which requires it be absolutely 100% organic mint, kale, lettuce, celery, cucumber, apple juice. Now, if you happen to have a kid that might by chance somehow have a genetic allergy to one of those vegetables or fruits, you can go to the Women's Health formula, which is in a 100% organic watermelon, apple, beet, pomegranate, strawberry juice with added cranberry. Organic cranberry, of course. So more fruity in that respect and less vegetably. But the fiber from the vegetables and fruit are the prebiotics that are being fed. And there's virtually no sugar. It's 4 grams in the entire 2-ounce shot, or actually less because it's already been eaten, and it's all natural, not added sugars. My diabetic patients can actually take it safely without a problem. And this is key. Because there is no fermentation taking place, there is no alcohol like you find in kombucha. So there is no alcohol. And these strains were all studied to show beneficial effects for just about every gastrointestinal disorder, as well as anything else that the mother may have. On the other hand, also, as studies have shown, extremely beneficial if your baby happens to have colic. Another very important one is Lactobacillus rhamnosus. And once again, that's what you can find that in the product. So it's already there. And like I said, tested for safety and obviously proven benefits in many studies. And that's one of the problems. And that's one of the major problems caused by different products that are given. If they're not tested for safety and benefit, how do you know they're going to work? You could be wasting your money. This product has now been used for, God knows, maybe 10 years, and it's being sold all over the world in Europe through, you can get it in Europe, you can get it in the Southeast Asia, through countries there. If you contact Doctors Biome, they can tell you how to get like Nutrined sells it throughout the EU. And of course, you can buy it online here, and they can ship around the world, I guess, from what I gather. Just costs extra. Free shipping in the USA, which is important. And what's been studied is the safety of probiotic and prebiotic products during pregnancy and lactation. And virtually, there are none when you're using a quality product like Doctors Biome. There are none whatsoever. I mean, anybody can have some kind of a sensitivity. If something like that does occur, they have a 100% money back guarantee. You cannot lose. In fact, it's better than 100% money back. They don't want you to send the product back to them. They'll tell you to give it to somebody else that might benefit in the family, and then they'll give you your money back as well. So they're so confident that the product is so beneficial, there's no reason not to use it and to offer it that way. So extremely beneficial in colic. And in fact, in one study using just those 2 strains, children had 51 minutes less crying during the day. Babies that were colicky had 51 minutes less crying per day because their stomachs weren't so upset. Now let's talk about, and let me get into that before we run out of time. When you're pregnant, you can take a 2-ounce shot either of the Women's Health or the Gut Health. It comes in 2-ounce bottles. You can go online and read all about why it's so beneficial and whatnot and everything else. But you take 1 2-ounce shot a day for pregnant women, and after pregnancy, the same. After you give birth, the same. Now for babies, I always say wait the first month. Give it 4 weeks. And then you can start giving the baby through an eyedropper a few drops a day. Each time you feed them, just a few drops, about a half hour before you're going to feed them. They'll love it. They'll just suck it up. Like maybe a half a cc or a cc at most. That's all a newborn baby really needs. The reason I say don't give it during the first 4 weeks, because if there's any medical or health issues, you don't want the pediatrician to be concerned that it may have come from the probiotic. Let's get the baby a chance to get stronger and adapt from the trauma of childbirth. So starting at around 1 month, I would say 1 or 2 cc's a day, 3 cc's maybe if the baby was a biggie versus a littly, like a premature, can only benefit them. And certainly, most importantly, I take Dr. Do No Harm very seriously. By the time they hit 2 to 3 months old, let's say 3 months old, now you can probably go to about 3 or 4, even 5 cc's, 5 mLs of this a day. And you get an eyedropper that's measured in this, and you can give it in divided doses a half hour before they eat, before you're going to feed them again. And that's whether you breastfeed or not. When a child is reaching the 6-month stage, I would say definitely 5 or 6 or 7 mLs of it, every day. 8 mLs every day would be more than enough, more than beneficial. Because this is such a highly concentrated version, you don't need the whole bottle for a little baby. Babies, now you're treating children, let's say 6 months to 1 year, 10 mLs, more than enough. 10 mLs, that's about a third of a bottle. Okay. It's going to help prevent ear infections and getting colds and getting flus and things that a baby's immune system might be more susceptible to. You know how kids have to get those ear infections all the time. It can make a big difference because the gut communicates with every organ in the body. It's called the gut organ axis. Go look it up. Go to AI and look up the gut organ axis and the importance of it. I've done shows on it, so I'm not going to spend time on it here. Children, let's say 2 years to 5 years old, can do 12 to 15 cc's, 12 to 15 mLs of the liquid. That's getting close to half the bottle. Once you're hitting 8 to 10 years of age, we'll start to hit that age group. Definitely half a bottle a day is more than enough. It can be given in 2 or 3 doses if you like, before they eat, a half hour before they eat each meal. You don't have to give it all at once. When a child is 10 to 12 years old, definitely you need to be at half to 3/4 of a bottle. And when a child has hit 15 years of age or more, 14, 15 years of age, they can do the whole 2-ounce shot. Don't worry. If you gave a little more, there is no harm done. The key is you want to have a bowel movement that, with babies, that happens frequently. With children, they sometimes get constipated. Well, you want to have a bowel movement at least once a day. All right? No less than once a day. More is better, but once a day. 2, 3 times a day, 4 times a day is ideal. Cleaning out that waste makes for a healthier body. You're not absorbing toxins or anything. I hope that gives you an idea on why. I mean, you're going to help prevent infections in the child, in the baby. You're going to boost their immune system. You're going to ensure that they have healthy organs. It can help in the prevention of autism. It can help in the treatment of autism. Autism now is 1 in 30-something children. So just that alone makes this an essential product. Children today are overweight. It can help in keeping their weight in control. It's called the gut weight loss axis. Can't easily lose weight if you don't have a healthy gut. Your metabolism is thrown off. Okay, so it can help in all these different things with children, and it may even help with if they're a problem child, if they have, uh, how should I put it? They're abnormally difficult to manage. Okay. One study showed children can be allergic to milk, and it can cause emotional reactions in them, horrible reactions in them. So consider going to doctorsbiome.com, doctorsbiome.com. Sounds like biome, pronounced biome. Doctorsbiome.com. And buy an order of it. Again, you can't lose. It got money back, 100% money back guarantee, 100% satisfaction, free shipping. Use my patient coupon code, Howard35, Howard35, and you'll get 10% off the retail price. After you've been using it and you're happy with it, go on auto ship, get another 10% off. It's not an inexpensive product. So saving 20% is a wonderful, even 10% is a wonderful thing. And I wanted to do something for you, so I got the company to kick that in. Howard35, and then go on auto ship for another 10% off. If you have any questions about this, email me at ozonedoctor@yahoo.com, OZONEDOCTOR@yahoo.com, or call my office in Manhattan at 212-581, 212-581-0101. That's 212-581-0101. Everybody, thank you so much. I want you to have healthy kids. I've got 7 grandchildren and 1 on the way that are all very healthy ones, and there's nothing like having a healthy grandchild. If you knew, as the joke goes, if I knew how wonderful grandchildren were going to be, I would have had them first. That's why we put up with our children, so they can give us grandkids. But not having a healthy grandchild is nothing but the worst heartache in the world. So absolutely, definitely get Doctor's Biome. I promise you, you won't be sorry. Stay safe, stay healthy, stay well. And, oh, yes, please subscribe to my channel. Look at all the different podcasts we've done and subscribe to our channel. You won't be sorry. We've got a lot of important information here, and God knows something may happen to you or somebody you know and love, a family member or friend. And one of my shows may be the difference between life and death, or suffering or not suffering at all, or minimally anymore. Bye now.